how's it going, Rayson? My name's Tyler. I'm a student of physical therapy under the direction of Dr. B. And so this is our initial exam today. I haven't seen you in your home. A little bit different from the sniff setting. So since this is my first time here, we're just going to be doing another little eval, getting to see some of your vitals and some outcome measures, kind of looking forward so I can track your progress a little bit.
Sure.
So in order to do that, I'm going to have to be a little hands-on. Is that something you're okay with?
Yeah.
All right, so the first thing we're going to start with is your vitals. That includes your respiratory rate, see how well you're breathing, your heart rate, see how everything's functioning, and also your blood pressure. So I'm going to place this cuff on you. You just relax. I'm going to do all the work, okay?
All right.
So if you just relax here. Doing all right so far?
Yeah.
All right. Everything looks pretty good. Your pulse was 62 beats per minute at a 2+, and it was regular. Your respiratory rate was about 13 breaths per minute. And then the only thing that was a little bit elevated was your blood pressure at 148/82. And hopefully as we get you moving and as we progress, that'll go down a little bit.
All right.
So now we're gonna get into some outcome measures. The first one that we're gonna perform, or you're gonna perform, I'll walk you through it, is the 5 times sit-to-stand, and that's kind of looking at your strength, kind of your balance, and some of your transitional movements. It's also going to give us a look into kind of where your fall risk is at. And so I know one of your big complaints here is getting up from a chair, And so that gives us something to look at as you progress too and see how this changes. The norms for your age group for community ambulation for somebody at 60 years old is about 11.4 seconds for 5 times, and that is an average. The second outcome measure we're gonna do is the 2-minute step test, and that's kind of gonna be testing a little bit of your endurance, balance as well, and it also translates very well to walking and stairs. So what we're gonna do is when we get up, I'm gonna show you about the approximate height that I want you to go with your knee. It's about mid-calf or mid-thigh here. I'll put a little mark on the wall so it's a little bit easier to keep track of. This will help. It's gonna be a whole 2 minutes, so for endurance, if you feel tired or anything, let me know. We can take a break, it's fine. So we'll get up and do that now. All right. You just want to take a seat here. I'll run you through some of the instructions. So we're going to go through a practice trial first. So what I want you to have is your arms across your chest like this, and you can have your back against the chair. And so what we're going to do is we'll do a practice trial first. So you're going to sit, starting and sitting, and you're going to go to standing. You're going to go up and down a total of 5 times.
All right.
Okay. On when I say go.
Okay.
All right. So since this is a practice trial, I'm not going to say go. So whenever you feel comfortable.
Okay. All right.
Okay.
I think that's 5.
How'd that feel?
Felt all right.
Okay. So we'll take a little break, and then we'll start with the 2 official trials. All right.
All right.
So this one, you're going to listen for me to say go, and you're going to go up and down as quick as you can 5 times. All right.
Okay.
Ready, set, go. 1, 2, 3, 4, 5, and stop. All right, I'll give you a little break and we'll do it again.
Okay.
You ready?
Yep, I'm ready.
All right, ready, set, go. One more. And stop. Feeling okay after those?
Yeah.
All right. So the next one I'm gonna have you do is I'm gonna have you stand up, and I'm gonna move this chair out of your way. And so if you could just stand near the wall here, and I'm just gonna look at approximately mid-thigh. We'll place this marker here. So that is about the height that I want your knees to be at when you go. So I'm also gonna place this gait belt on you, just because this is a little bit more endurance and balance component, and I know you're struggling with that. This is just for both of our safety, okay?
All right.
And as we progress, hopefully we won't have to use this as much, okay?
All right.
Okay, so what you're gonna do is you're gonna stand in place and march for 2 minutes, okay?
All right.
And your goal is to get your knee to here.
Okay.
All right, whenever you're ready.
Okay.
Ready? So with his 5 times sit to stand, both trials were about 15 seconds. So that puts him a little bit slower than the norms for community ambulation for his age. And then for the 2-minute step test, he got about 90, which puts him in that the 25 to 75% range for his age. Grayson, after those outcomes, we're going to talk a little bit about your plan of care going forward. And so just looking through your past medical history and some of the things I saw today with the outcome measures, it looks like I'm going to include or kind of build a plan around a little bit of endurance, just because you're kind of on that lower end for your 2-minute step test. Strength kind of works through some power stuff, just because you were a little bit slower than what we expect for the norms. We want to kind of get you in that 11 and a half second range, and you're at 15. And so I think that would be very helpful. And then maybe some stuff, exercises, just a little bit of maybe cardio, try to help with that circulation. I know you have some edema, and so I think that will help out a lot as well. Do you have any questions for me?
No, that sounds good.
All right. So getting a little bit more into his plan of care, we saw that decreased strength with his 5 times sit to stand. And so really want to focus on a strengthening component for his rehab. And we knew that coming in with one of his primary complaints being kind of that sit to stand motion, getting up from a chair. We also want to work on his endurance. We saw with the 2-minute step test that he was technically in the norms for his age, but he was right on that bottom level of that norms, right around that 26%, with only getting 87 steps in that 2 minutes. And we kind of want him up in that 115 range. That puts him up in that 75 percentile area. We also want to work on kind of general balance due to that 5 times sit to stand as well, and him not being classified as a community ambulator for his age. One way that we can monitor him and progression through his exercises is using the RPE scale. And so this is very easy to follow, and compared to vitals, it happens instantaneously. And so we don't need to check blood pressure, check O2 sat with the pulse ox. This is very easy. You just have to explain it to him once, and it's easy to follow up on. If we wanted to, we could also use the dyspnea scale along with an RPE scale. So kind of getting more into specific interventions, and what we would do is we'd want to do a warm-up, an active warm-up, kind of get him warmed up a little bit, get the heart going a little bit. And so something we could start off with seated marching, and we can progress that to standing marching, and we could even hold in some type of weight to add a little bit of resistance factor. And this can double as an intervention as well, because it's going to be helping with that endurance that he is lacking. Moving on from there, we could start with sit to stands. And if that's a little bit too hard, we can regress to a weight shifting program, just kind of have him be a little bit more comfortable up on his feet. And then after that, if those are a little bit too easy, we can progress him more to like a squat, like a point A to point B thing. We can add resistance to it with some type of weight, something around the house that's nice and light, something easy that maybe he is carrying throughout the day, or if he likes to do something of similar weight to make it a little bit more functional. And that's going to help because he is having that trouble from going from sitting to standing. We could include some bridging or clamshells to work on length strengthening as well. And those can be regressed and progressed easily with different types of bands, different resistances. And all of these, we really want to start off, once we get a good base, but we want to try to do high repetitions just because of his current health. Some of the goals related to the functional outcome measures is we really want to focus on getting him below that 11.4 or around that 11.4 seconds for that 5 times sit to stand. And then just because he is in the home setting now, so he's going to try to be a little bit more independent, and we really want him at that community ambulator level. We also want to increase his endurance, try to get him up to that 115 steps for that 2-minute step test.
and really no fatigue throughout that. In the tests, we saw him say that he was fatigued about a minute in, and he considered taking a break. But so getting through that 2-minute step test without fatigue is really beneficial for this patient. And then we also just want to increase his general health and aerobic capacity kind of with those higher rep exercises, just because of his comorbidities that he has and what we're seeing him for without heart health, and also because of his where he's at weight wise. I know he was unhappy with that and looking for dieting tips as well. We can refer out for that just because it is not typically in our scope of practice if we do not feel comfortable. But other than that, the big thing that we see for this patient is really that endurance and that strength, because he wants to be able to stand comfortably.